Athletes who jump a lot and who jump high are likely to get patellar tendinopathy. We should look at where the degeneration is happening. Is it happening on the front or on the back? In this study, they found that the back, the posterior region, is exposed to the most stress, especially with jumping. It's exposed to more on the back than it is on the front. So if we're talking about patellar tendon degeneration, it's going to be happening on the back, as you see in this video. This study in 1996 found the same thing with MRIs. They found that the superior posterior central proximal attachment was the region of degeneration right there in the back of the patellar tendon, not in the front. That is in the back of the patellar tendon. Same thing here they found with patellar tendinopathy, the focal areas of increased signal intensity within the posterior aspect of the proximal patellar tendon. So it's not on the front like this, but the signal is going to be coming from the back. That's the area of degeneration when people have patellar tendinopathy. So if we use the leg extension as the best way to isolate the patellar tendon, how can we better hit the posterior region? Would it be an extended leg extension or would it be a flexed leg extension? This study on the patellar tendon found that during flexion, its central proximal posterior region exhibited highest peak stress and strain. A similar finding in this study where they said when the knee joint was flexed with the application of uniform tension on the quadriceps muscle, the strain increased more on the posterior fibers than on the anterior fibers with knee flexion of 60 and 90 degrees. Again, for flexion, this study found that the posterior fibers of the patellar tendon are subjected to the greatest tensile strains when the quadriceps tendon is loaded with the knee flexed. So all of this supports what I already said in this video, where if you want to get more stress on the patellar tendon in general, go deeper into flexion. But now what I'm saying is if you want to get more stress on the posterior region, go deeper into flexion. So if you want to do extended isos, great to activate the quad, great to decrease pain. But if you want to adapt the area of degeneration, get deeper into flexion. 60 degrees, maybe even 90 degrees, and you can hit that specific area to heal the tendon over time. Try it out. Enjoy.